Hello, I'm Dr. Joel Lindeman with Lindeman Chiropractic, and today I wanted to talk to you a little bit about something I see a lot in my office, which is anterior head carriage. What anterior head carriage is basically how it sounds. The head starts to come anterior or forward of where it's supposed to be. Number one cause of this problem is this right here, a computer. TVs and video games, that type of thing too, but we're always connected to these things. Now we may start out with good posture where we sit up straight, keep our head back, and we do our typing. After a while we start to do this and we start to get that hunchback look, okay? The reason that we care about this is think of your head as a bowling ball. Weighs about the same as a bowling ball, 8 to 12 pounds, somewhere in that range. If you have a bowling ball and you have it close to your center of gravity, so you carry it close to you, you can walk around and carry that for a long time without getting too tired. If you start trying to bring that bowling ball out here and you try and walk around, you're going to get tired quick and cause muscle soreness. Same thing with the head. If the head starts coming forward like this, the body will actually start to adapt to that and stretch out the ligaments, which will increase pressure on the trap muscles. That's why so many people, want to get neck rubs, and when they have trigger points in here, almost every single one of my patients actually has something going on at the traps there. Besides just the muscle soreness, though, having the cervical spine decrease increases the pressure to the intervertebral discs and the ligaments there, so you can actually start to get early degeneration, early arthritis, herniated discs, all sorts of nasty stuff just from this simple issue that we're having. So a couple things to combat this is when you're at work, every hour at least set up a time to where you give yourself 5 minutes to do some stretches. And basically, you're used to typing on the phone, or typing on the computer, using the phone. Stop once an hour, sit up straight, get those shoulders back, get that head back, okay? An exercise you can do when you're not at work is when you're in the car and you're at a red light, put up your headrest, make sure it's behind your occiput, which is the base of the skull right here. And you can work on giving yourself a double chin. It's the one time you want to do this to yourself. Basically, you just want to take your head, push straight back into that. Okay, what you're doing is you don't want to extend back, you just come straight back. What you're going to do is stretch out those muscles and help get that curve back to where it's supposed to be so the center of gravity is correct. Thirdly, obviously, if you haven't been checked by a chiropractor, you should at least get checked. Everybody should at least have a spinal checkup, just like you would to have a dental checkup or a physical. You may not need chiropractic care, which is a good thing, but it's always worth looking at. My job as a chiropractor is to find issues like this and correct them, so it's easier for you to get back to health and to limit problems in the future. It's a lot easier to get yourself treated while you're healthy to maintain health than it is to try and fix something that's there and trying to fix a problem. It's also a lot more inexpensive if you keep yourself healthy rather than trying to catch up to health later on. That's all I have for today. There'll be more in the coming weeks, but thank you from Lindeman Chiropractic.